physical therapist. I'd like to welcome you all to Therapeutic Seating and Positioning, presented by Skillz First and myself. Just to give you a little bit of background about myself, I am a physical therapist. I'm a clinician. I work for HCR Manor Care as a physical therapist, treating every day, a variety of geriatric patients. My background is as a physical therapist. I've worked in the clinical setting and also as a manager, and also as an education and training to be able to do a mat evaluation for seating and positioning, to be able to identify what elements are crucial in positioning, to be able to know what impairments cause poor positioning. And what we find is that we can see a rotation issue. A lot of times when the trunk's not supported correctly, maybe you might have a rotation and equal foot plates, but one foot reaches the foot plate and the other one doesn't. On this, the normal spine, you've got the normal lumbar curves, you've got the lumbar curve, integrity. Obviously, we're having more contact areas that could potentially demonstrate breakdown, because generally bony prominences and weight bearing don't get along too well, especially for long periods of time. So what we want to try and do is get that pelvis in an optimal position for all of those systems that we talked about before. Okay, so what can cause posterior pelvic tilt? But generally, I mean, just looking, is the upright midline? A little slide. Okay. Yeah, I mean, he doesn't, generally I would count this as an example of, he's not somebody that might trigger right away in this position. Okay, now, if you've got a wide selection of wheelchairs and you can swap out, wheelchairs, yeah, the wheelchair is definitely too wide for him, but generally he's sitting in it okay. So he's not somebody that would necessarily trigger me walking down the hallways on a screening hunt for patients to get to be on my seating and positioning program. Okay, now you're walking down the hallway and you see this. Okay, so this is a more dramatic example, but this is something that I see on a daily basis, and I think you guys can see this on a daily basis. Okay. Now, this may be a seating and positioning issue, or this might just be a daily schedule issue. Okay, so again, but it's really incumbent on us to be able to do these types of assessments as efficiently as possible. So with that, let me start the video.
Welcome to the mat evaluation for wheelchair seating. In this video, I will review.
Okay. Height. And it's to the point now where, for the most part, you don't really even need tools. Now, unfortunately, this wheelchair doesn't go from standard height to hemi height. It's called a transformer. And if I can do this correctly, this comes off as the wheelchair gets me. Thank you. And without that, it's pretty light. I mean, relatively light. The armrests are adjustable for height by pressing a button. You see the little button. So standard wheelchair tends to hold you up in that 90-degree angle. This wheelchair you can recline back, okay? Or recline the seat back. The seat doesn't move at all. We had talked a little bit about the patient with whether it's fully upright or recline back some, because remember, recline is when the seat stays still but the back goes back, like that. That whole seat back and seat complex as one unit, like so. So it allows you to accommodate, have a stable base for their pelvis to be in an optimal position. But we don't get great pressure relief or pressure redistribution with this type of cushion. Okay, so if you've got patients who do have significant skin issues or are at significant risk of skin breakdown, then foam seat will actually, if the patient moves, the seat will actually, the gel will allow the seat to move with them. So the shearing is occurring within the gel. My hand is the Roho pump. I'm going to show you. You all have in your handout or in your packet instructions from the Roho website on how to properly inflate and adjust a Roho cushion for your patient. Depending on the type, there are different types of Roho cushions. There are low profile, like this is, which is just a low, the air cells are smaller. There are high profile, which means it is a restraint. So it can be very confusing and inconsistent at times when you're dealing with equipment that may or may not be a restraint.